Hey, y'all all ready? All right, well, good afternoon. Once again, I appreciate you being here for the 3 o'clock update. I'd like to begin my remarks this afternoon by saying, there's a special group of people who live in our city that we really need to think about and pray for. And we talk about our first responders a lot. But seldom do we ever mention their families, their wives or their husbands, their children. So stop and think about it. Every day when they leave, their wives, especially in this situation, they know that they could bring something back to their family and not even knowing they're doing it. So we need to be very thoughtful, empathetic, sympathetic, and grateful for what all our first responders do. And let's broaden what we typically think about those first responders in this current situation. We talk about nationally, when you talk about first responders, that's fire rescue and police. But we talk about it also in our sanitation workers within the city of Mobile. But there's another very special group that are first responders today, and that's our healthcare officials. I mean, all the nurses, the orderlies, everybody in the hospitals and the doctor's office. So as a community that of which we all love, let's keep them in our thoughts and prayers. Today, it's actually the executive order for the big boxes went into effect. I did not check in on the big boxes this morning, but based on all the conversations that were being had yesterday, I feel like great progress has been made. I do need to admit that yesterday, upon being prompted, maybe I'm not sure exactly where it came from, but I made a phone call about the capacity in the stores of one of the Home Depots, and I got an answer. But then I did find out the media had called, and actually the stores had called, and there was some confusion. We track the capacity of stores, but really it's for restaurants and places where you eat. And so when it comes to a Home Depot, there was not a chart or a place where we could go do that. But we came up with a pretty quick formula on how to resolve that. And so I think today that everybody that's in question, they know what their capacity is. And really, there's a couple of ways to get at that number. One was that a lot of these stores, they are tracking their revenue per square foot of the store. And so if you take the square foot of the store and came up with you divide by 75, that's probably your capacity. So for this point in time of trying to determine that, they all now have a rule of thumb that's very simple on how to get there. Figure out the square footage of your store, divide by 75, and if we need to tweak it, we'll tweak it. Anyway, so very appreciative of what the stores have done to make sure that they have no more than 40% capacity, and that's your big boxes and your grocery stores. It comes up a couple of times about what about the CVS's and the Walgreens. I'll say it again. Very seldom do they ever get anywhere close to capacity. So if you are going to Walgreens or CVS, you really shouldn't be concerned because you will not see them blocked out with too many people. The enforcement of that will be by the Mobile Police Department, but I know that today's society, we have a whole lot of people with cell phones, and if they see something that they think is maybe outside the realm, they seem to let us know. And so that's all part of this self-policing that we have going on. Earlier today, the 10 mayors of the largest cities, we had an opportunity to speak with Governor Ivey for probably 45 minutes. During the first 10 minutes or so of that conversation, she was going down a list, kind of a briefing list of things that are doing, that are going on, things that are changing, new information, and then she wanted to hear from the mayors. So all 10 mayors, they weighed in with some concern of how do you look at this and how do you look at that, maybe why, Governor, haven't we done this? And one of the things that was very apparent, and that is this, that there are a lot of definitions of shelter in place. And that's something that we will try to define for our city, but the state of Alabama was way ahead of a lot of people sheltering in place, not calling it that, than some of the other states. And some of the other states that recently announced that they were sheltering in place were really catching up with the state of Alabama. So we're hopeful that there'll be some clarification about the comparison of who's doing what, because every single shelter in place, there are exceptions. And in some places, there are a whole lot more exceptions than other places. So it's misleading, because in your mind's eye, or in your mind, you're thinking, oh, that means everybody's staying home. Well, that's not really the case. There is nowhere that everybody is staying at home, okay? I'm talking with Director Barber, which he'll speak to this in just a few moments. He'll be talking about where we stand with Ladd Stadium and some other things that have having to do with public safety. Before I call up some of our guests that we have, a special guest today, I'll say it again and say it every day. Our foremost concern is your health and safety. Everything we're doing right now is trying to assure that we're trying to keep you safe and healthy. I don't know if it was the governor that said it this morning, or if it was on the conference call we have at 8 o'clock with the team. And that was that, there are not a lot of good choices right now. But there are good decisions that can be made. And so how are you making decisions? Hopefully that you are listening to a lot of people, experts in the matter. You're listening to a diverse group of ideas, diversity in every area. And then you think of not just the decision that you're making, which is a first order thinking, but you're thinking of the impact that has in the second order and what it has in the third order. First and foremost, this is a health crisis. But for those that don't want to believe that it's not impacting the economy, then you're only thinking the health crisis, and you cannot separate them. So as we continue to go through our decision tree on making things, I would like to look back and say that we have been very methodical and very thoughtful about decisions that the city has made, especially when you look at the financial implications and the decisions that have been made, whether it had to do with employee pay, when we told them there would be no raises my first month in office, to having given 5 raises subsequent to that. So we are today gathering all the information that is available. We're doing what if this, what if that, and we're trying to make projections on everything that people have brought up, from having to do with hazard duty pay to you name it. We're trying to model it. But this is not like a hurricane to where that in about a couple of 3 months that you will have worked your way out of it. Because in that hurricane situation, it's geographically specific, and it's pretty much time specific. We don't know the ending date of this, so we have got to conserve the resources that we have financially to make sure that we're in for the long game. So that has a lot to do with some of the decisions. It certainly has everything to do with that decision process right now. Another thing that I look at, or that we look at, is let's talk about the statistics. So today we have 61 cases identified. Yesterday it was 56. So that's about an 8% growth in the cases. We all know that we tested more people, but we only had 8% growth. If you look at the number of ventilators that were available yesterday, there were more ventilators available yesterday than there were the day before. There were more beds available in the hospital yesterday than there were the day before. So when you look at those things and then you realize what else is going on in this nation as far as the increase in cases, we don't need to put ourselves in the boat with New York City and possibly even New Orleans. Now, I know those statistics are going to change, and so do you. And so the deal is that we make these decisions, whether it's looking at the possibility of the shelter in place or a curfew, and at the right time when we think that we want to be ahead of it, that we'll pull those triggers when we think it's the right time to do that. So at this time, I would ask first person I'm going to call up is Dr. Bill Admire, who was here about a week ago, and he's with the Infirmary Health System. So, Dr. Admire, if you'd come tell us what's going on at the infirmary and just in healthcare in general.
Thank you. Good afternoon. Thank you, Mayor Stimpson, Director Jim Barber. I'm glad you asked me to come here today. I wrote down a few notes I want to talk about. Ducktailing Mayor Stimpson, we're in this together. Infirmary started a campaign guard. We are here together. With the population of 500,000 in our big general area, a lot of it Mobile County and the city of Mobile, we're soon to have a pandemic that's going to come here, and we'll probably get our surge, if you look at models, maybe in 2 weeks. And then you get a peak mid-May, hopefully. And how are we going to overcome this? Well, I want to rest assured that all of you know that the infirmary health system and the other hospitals in town, because we're all here together, is we're making plans. We're planning on a daily basis for the last 3 to 4 weeks on how the hospitals, with the physicians, the nurses, and all the ancillary staff and the administrators working together planning to handle this pandemic. Coronavirus, I try to tell everyone it's here, it's not going to go away, but we're going to confront it together. And we're going to overcome it. And the way we do that is realize that as a unity, public officials, hospitals, the community itself, all the people, you lead, you become a leader at this time when we have a crisis. You have the courage to be a leader and do what is responsible that our leaders are telling us to do. The CDC has given us guidelines. Our mayor, our director of safety, the hospital, the doctors, nurses, listen to what they're saying. We can blunt the curve of a big surge or influx of patients to the hospitals. What the hospital at the infirmary is doing, we have approximately 680 beds. We have over 80 intensive care units. We have 1,200 nurses that will treat our coronavirus patients and our patients that don't have coronavirus. We're still going to have heart attacks, strokes, deliver babies, and have trauma. We're prepared to do both because of our preparation. We're cross-training our nurses. We have 600 physicians on staff, and we're going to have our specialized critical care pulmonologists in the intensive care units. We're going to increase our intensive care unit beds. We're going to increase our number of ventilators. We're going to increase the capacity we have for overall number of beds. We might be at 1,000 beds. And then what we'll do is have 24 hours, 7 days a week coverage for the surge of patients that come in and give them the best chance of overcoming coronavirus. Remember this, out of every 100 patients that comes in contact with coronavirus and develops the disease, 98% live or more. 98% or more. And only 80% go seek medical help. And the others that go see medical help may get hospitalized, and a certain portion of them will need ventilators. And that's where the tough part is of handling the coronavirus. Helping these people that become hypoxic with decreased oxygen in their lungs. And then we'll have our intensive care doctors in conjunction with all the specialties coming together, surgeons, anesthesiologists, medicine doctors, and subspecialists, all working in the units 24 hours a day to help these people. So I'm giving you assurance that the infirmary health system, the other hospitals, the physicians and nurses and administration are up to the task. Yes, we're scared, but we're not scared that we won't do well because we're going to make the right decisions. We're going to overcome the coronavirus. Thank you very much.
So at this time, Dr. Laura Cepeda will come make her remarks from the Mobile County Health Department. So when you step off, don't fall.
Thank you, Mayor. Good afternoon, everyone. Here for your daily update. So I think the Mayor mentioned today Mobile County is at total of 61 COVID positive patients. The state currently stands at 1,060. Baldwin County currently has 24 COVID positive patients, up from 23 yesterday. Mobile County has 5 new patients today. Statewide, the reported deaths are up from 26 to 32 today, but the confirmed deaths are holding steady at 17 for now. We do have the 3rd death in Mobile County to report today. And while overall, we're expecting about a 2% mortality rate from COVID. This puts Mobile County at about a little over 5% death rate from our confirmed positive patients so far. So that's something to keep in mind, that as we're happy to see a slowing in our doubling rate, and we are, as Dr. Admire gave us the good news, that our hospitals are doing a great job and have the capacity that we need to take care of the patients so far. Just again, this is not something to get complacent about. We do need to really hold firm and keep up that social distancing. Everybody, keep it up, keep your hand washing, and just limit any activities that you do to only the most necessary. Overall, the United States has over 200,000 positive patients with greater than 5,100 dead, and worldwide there are over 1 million cases of COVID in the United States. We've been getting a lot of questions about when it's okay to return to work if your job is considered essential. The guidelines, if you have not been tested but you are either exposed and then you were febrile and presumed to be positive for COVID-19, are all of the above. You have 3 days without fever and without anything to reduce your fever, like Tylenol, ibuprofen. Other symptoms like coughing, shortness of breath, any symptoms that may have come along with the onset of those, the fever, all of those have resolved again without having to take medications. And it's at least 7 days since you first experienced the onset of those symptoms. At that point, even if you have not had testing, then you may go back to work if your job is considered essential and you need to return to work, and all of those conditions are met. Those guidelines are per the CDC, and you can find them on the CDC's website as well if you need to. I think that is, we do have our updated demographic data available since we are over 50 cases. If you want to find that, that's on the Mobile County Health Department's website, and for anyone to see if you need it. I think that's all I have today. Thank you, Mayor. Thank you for the stool.
At this time, I'd ask Shonda Smith, Head of Parks and Rec, to please come forward. With the beautiful weather that we're having, there are a lot of questions about what can and can't be done in our parks. So Shonda, if you'll come tell them.
Hello, everyone. Thank you. It is a beautiful time out. Everyone wants to be out, but we want to make sure that we're responsible. We're encouraging you to go to the parks and walk. You can run, you can fish, you can actually kayak, you can actually go to our boat launches. What we are discouraging you from doing is getting on the amenities where you would actually transfer. So the playgrounds are actually closed, soccer fields. We got a call the other day, asked could they do disc golf, and we talked it through. If it is something that you are sharing a ball, you're sharing a tool in order to play, then it's a high chance for transfer. So we're encouraging you to go out and walk and to participate with family members. So this is not a time for play dates where you still take kids and they play together. The goal is to actually separate and be with your families and spend time. Great ideas for picnics, but not on a picnic table. This is where you bring a blanket and you sit down and you eat with your family and have a good time, but being sure that you're not, touching the rails, not touching the playgrounds, not sitting on the benches, because again, these items are not sanitized, they're not cleaned, and so we don't want that transferred to you or for you to be transferring that to others. Another word of note is that cemeteries are parks as well, and so just being mindful of that. This is a sensitive time when there's services, but being mindful of the, it's hard to say, but the 10 people, but also being able to encourage family members to not crowd when they're at the cemeteries, but to respect space as well. And just being mindful of space. We want you out. I think I've met more neighbors now during this time than ever before because I'm out walking every afternoon. And so we want you to get out because it's important to your emotional, physical, and mental well-being. It's important for that, but just being mindful as you are out that you are sharing the space, but you're sharing it responsibly. Thank you.
So now we'll hear from Director Jim Barber.
Thank you, Mayor. And as the Mayor mentioned earlier, have been out at the Ladd Stadium site. Today we began our first actual procedural testing by running actual patients through the site, very limited number. We also did first responders at the site, but the first responders, as we have been doing, are being tested for the antibodies for the COVID-19 virus. We did have one of the first responders that tested positive for that antivirus, and then the PCR swab was then taken and collected and sent to the laboratory. So as we continue to refine our process at the stadium, working with the University Hospital personnel, you will see us continue to ramp up the patient care that's happening at that facility. I do want to point out that it is a medical evaluation that is conducted before the PCR test is actually given, and so it's not a mass screening of the PCR test. As far as our first responders, including the firefighter this morning, we have 28 positive tests on the antibody test, and so all 20 of them are now awaiting the results of the confirmation test or the PCR test. Some of the changes that's occurred in the Mobile Police Department since the onset of the COVID-19 virus, I had mentioned this once before, is that we're looking for ways in lieu of custodial arrest, and so we have come up with that working with the courts, the prosecutors, and the judges. And there will be an appearance bond and notice to appear that will be issued on minor offenses that are nonviolent. And so, say a misdemeanor shoplifting case. In those cases, it will reduce the number of patients at the jail. You've already heard the concerns about our facilities as far as our correctional facilities. And so we'll reduce the exposure as well as exposure of the officer to the individual that is receiving the notice to appear. Now, you still have a right to a custodial arrest, and so if you want to refuse to sign this particular paperwork to appear in court, we'll certainly oblige you on the custodial arrest. I want to mention before I walk off about scams. We brought that up before, and I don't think you can say it enough, but there's a lot of scammers that are taking advantage of people because of the stimulus package, and so make sure that you should tell all of your family, your loved ones, your friends. The government will not solicit your banking information over the telephone or via email. You should never fall for that type of scam. There's also other medical scams that are going on, people claiming to have vaccines, test kits, or the antivirus. And so do not fall for any of them. Make sure you go through your medical provider for any kind of medicine or medicine regimens. That's all I have. Thank you.
Every night, about 9 o'clock, I've been sending out through email, through an update, and anybody that's interested in receiving that update, they can go to the city website, to the coronavirus page, and just click on Mayor's newsletter, and we'd be glad to send it to you. All you have to do is click on it, give us your email address, and we'd be glad for you to receive that. Before I start answering any questions, I want to say that, and I hope I say it every time, that even though we know there are people that cannot sit inside but for so long before you go stir crazy, and really before it impacts your mental health, especially if you're sitting there watching fearful news all day long. And so you're going to get out. That's why we made the remarks about the parks and the things that we're trying to do. And we're encouraging the walking, but obviously if you don't have to get outside of your yard, if your yard is big enough to walk in your yard. Especially if you're at that vulnerable age, you certainly don't need to be taking a chance. So stay at home if at all possible, and we will continue to apprise you of different steps that we'll make going forward as this changes, because it's going to be different tomorrow than it is today. But I'll be glad to answer any questions that you have.
Mayor Stimpson, it's April 2nd, just after the first of the month. We've actually been getting a lot of questions, and I know you may not have authority over all of the different landlords who own rental properties in the area, but a lot of people are coming to us concerned about what if they can't make rent this month. And a lot of other businesses have postponed or made allowances for people who may have been laid off or servers who may not be making what they're used to making. Are you asking anything of the landlords at this time? Is there anything that you're saying to these people?
No, not making any announcements, not doing anything that, let's say, that would be encouraging to the landlords, but since you've asked the question, I'll make a remark. I would be very thoughtful if I were a landlord right now trying to put somebody out, because who are you going to replace them with? Where do you think the next person's coming from? So I hope that from a sympathetic, empathetic understanding of the situation, knowing that there's going to be a federal stimulus package, if there's ever been a time when you ought to give somebody, cut them some slack, it would be now. Yeah.
At what, you mentioned maybe waiting until more information comes out, until we know more before pulling the triggers on a curfew and a possible shelter in place. I know you've thought about that. Is there a point to which you would make that call, like a percentage of beds that are taken up or a percentage of ICU patients? What are you looking at as far as when we can see those triggers?
So Dale is asking me if there is a set of numbers that I would look at, that once we exceeded that threshold, that we would pull the trigger on a curfew or a shelter at home. And the answer, Dale, is that there are some markers in my mind, but it'll be a lot of subjective input also, based on other things that should go into that decision process. So it's a mixture of both. Okay.
You said from the point of the view of the mayors and the governors that we have some of the same regulations in place for shelter in place. Why don't you just call it a shelter in place, what it is right now?
So I thought about that today. And the question was, since we are sheltering in place, why don't I just call it that? I don't want people to think that I'm trying to nuance words and trying to make it appear to be something that it's not, because in our mind that's not what we sold it as. But I do hope that there will be a comparison made about what's going on, and so when we actually say shelter in place, will be, and this is based on suggestions from others. Be very, very specific about what is different, than what you've done and what you're doing. But there's not much we can do to roll out what's already been done. But there is sheltering in place right now. But I've chosen not to try to act like that we've made some radical changes. When we make some changes, then I may choose to use that terminology at that time.
Since you say that you guys have the opportunity to do a curfew and a shelter in place, what are the steps you can do beyond what was already in place?
So the question is, what can we do that's different than what's already been done when it comes to a curfew or a shelter in place? Well, curfew, easy. If you say that hypothetically, if you say there's going to be no one out after 10 o'clock at night to 5 o'clock in the morning, that's a big difference, other than if you're going to work, and you're first responder, a healthcare worker, those types of things. But there's not been the curfew discussed like that. When it comes to the conversation about a shelter in place, I think that what you would see is people will be focused on what is the change. What is difference about this order than what's already been done. Those are the kind of things that we're trying to be thoughtful about right now, and what is the impact of that. So,
yeah.
Yes.
You were kind of talking about the executive order earlier, about how it's going to be enforced by Mobile Police. What is that enforcement? Is that like someone will be handed a ticket? Is that someone might get arrested? What are the consequences that people face?
I think it's more on the big box. And I wish Ricardo Woods was here, but I think it's more of a ticket. Eventually, it would be let's get the real answer.
I mentioned that we do have an enforcement tool as far as making the arrests. It does make it a crime to violate the governor's rules. They actually become law when they put it under state of emergency. And so we do have the enforcement authority there. So I guess to answer your question, I guess I needed to repeat the question. If Mobile Police are going to enforce the rules of the state of emergency, and how would we actually do that? And certainly what we actually would do is voluntary compliance. So far we've went out to several locations, since the state of emergency where there was larger gatherings than that which was permitted that were reported to us. Officers asked for voluntary compliance or closure of the business, and we've so far received exactly that, voluntary compliance. I talked earlier about other mechanisms to be in lieu of arrest that we can use, such as the notice to appear. And as far as any curfews, usually that is handled by citation. And so we're certainly working with our legal department on how we would execute on something like that if there were a violation of that nature, because that's a fine that's associated.
So would that be the business that would get that fine, or would that be the people who are going to the store that are exceeding the capacity?
Well, the business owner let's say if we've got a business owner that isn't defiant, in other words, will not voluntarily comply with the governor's state of emergency orders or rules. As I told you, the rules now become law. And so the law, it's a violation, it's a misdemeanor violation. There could end up in custodial arrest, or it could end up in a summons to court. Okay?
Thank you.
Got some more questions for you, Director Barber.
Okay.
On the custodial arrest change, is that something you worked with Ashley Rich's office, district attorney's office with?
No, this is okay, the question is, using the summons in lieu of the custodial arrest, is it something we work with the district attorney's office on? And the answer is actually no. This was worked on through the municipal court, because what we're talking about, what we're dealing with are very minor offenses that are nonviolent offenses that would have ended up in municipal court in lieu of the state courts. Okay. And so that's how that came about. So it would have been dealing with the presiding judge, Holmes Wooden, with the municipal court.
My fault. Got another question for you. Of those new cases of COVID antibodies in the first responders, are they asymptomatic as well? We've talked about all but one so far being asymptomatic. Is that also true?
Yeah, all but one were asymptomatic to my knowledge, and I was just updated, so there's been 2 more added to it, and so we're up to 30 first responders with antibody positives for COVID-19. That breakdown is 10 firefighters and 20 police officers, and we're seeing roughly the same amount of disparity, that you're seeing a disproportionate number of police officers infected versus firefighters because of the unprotected contact police officers normally have with the public.
Firefighters in the city and the number of police officers in the city?
I can get you that. Roughly, you're talking about just with the uniformed personnel, about 900. Police. So 500 police and then roughly 400 firefighter.
While we have you up here, do you think that there will be more law enforcement, and more first responders tested as a result of these 4 numbers keep coming in?
We've not. Do I think there will be more first responders or law enforcement officers tested as a result of what we're finding out? We are about 2/3 of the way through the city of Mobile first responders, and so we'll complete that process for us. I do know the Mobile County Sheriff's Department has begun a similar process, and they also have ran into positive COVID antibodies in some of the first responders there as well. But I also was just on the phone with Mobile Infirmary. They are receiving calls from all the cities about how to test their first responders for these antibodies, and then the subsequent confirmation test with the PCR that everybody's most familiar with.
So we kind of heard a little bit earlier, but so these first responders, just like everybody else who is essential, they just follow the same guidelines in terms of when they're allowed to go back to work. So they will be allowed to go back to work.
You know, again, at what point will they be allowed to go back to work? Do they follow the same guidelines as the general public? No, they're actually part of the critical infrastructure personnel that the CDC recognizes. And so much like medical staff, just because we come in contact with somebody that suspected COVID-19, we cannot quarantine first responders. We'd run out of first responders. And so unless they're symptomatic or they're showing active virus through the PCR screening, they are not quarantining. Now, I will tell you that all 30 of these are quarantined until we can clear that they are not contagious, because the antibody does not tell us that. Only the PCR will tell us whether or not they are contagious. If they are not contagious, they'll be returned to work. If they are, then they'll be quarantined as in the general public at that point.
This started Monday, the testing, correct?
Testing started Monday, correct.
So you told us about this, I believe it was Tuesday, that you guys had done the PCR test on 3 firefighters, 1 police officer. You said it'd be 24 to 48 hours. We're 48 hours out, and you still don't have those results. Do you know when those are coming in?
Yeah, we are 72 hours out, and so we're testing a different alternative with a different lab. And so, but what we're finding out is that some are coming back in 24 to 48 hours, but we're also hearing some are taking as much as 6 days even now.
So none have come back yet for the nasal swab?
That's correct. None of the first responders can we confirm the COVID-19 virus. We can only confirm that the rapid test indicates that they have the antibodies for COVID.
Do you have any expectation on when those PCR tests will be coming back?
I think we should start receiving the first test at any moment now, and then maybe Dr. Admire may have a better feel for how long it's taking the labs at this point, and so I can certainly flip to him if y'all need to talk.
But they're not handling the tests.
These first responders are tested in partnership with the Mobile Infirmary Health Systems through the Diagnostic Medical Center. So they are handling our tests, and they are going through a lab, I believe Assurance Laboratories in Birmingham.
Data used by the White House has showed that Alabama is going to be at a greater risk of shortages of ICU beds and ventilators compared to other states. Do we have a plan?
So the plan actually would be, coordinated by the governor's office. She set up a task force to deal specifically with that. Every day they wake up, they are thinking about and trying to trace every lead that they can to get the PPE. Her comment today was for every lead they have, for every 100 leads that they have on PPE, only one is productive. But that is all they're doing is trying to see that if Alabama can get more. I know the hospitals individually are doing the same thing. We're actually doing that. I mean, if somebody calls us and says that we have masks or gloves, whatever the equipment is, we will make that phone call to see if it's a live one or not.
The same data has shown 5,500 deaths in Alabama as projected. Do you have any comments on that?
I really don't. No.
Jackson, Alabama just issued a curfew, which is the second one in Clark County.
Mm-hmm.
Right, I don't know if you were aware of that. They
I'm
were
not.
much smaller. Two cities in Clark County have issued a curfew.
Yeah.
And that still doesn't give you pause to want to issue one here?
So the question is that Jackson, Alabama, which has become the second city in Clark County to issue a curfew, and does that give me pause to want to do it here? Makes me wonder why they did it, but we're still monitoring what we're doing to try to make our decision, and I'll be curious to find out why they did that, but I don't know right now.
I have a follow-up question for the health department.
Yes,
At
come.
what point would you guys issue one, because you guys have that authority as a health order to do that decision to put that into place here? And you guys have that discussion? Are you guys in the process of doing something similar? Because a lot of people have been commenting that they believe it should be put into place, the same people who are electing public officials and also who you guys serve at the health department.
So the question was, at what point would the health department and the health officer specifically make that decision? And as I'm not the health officer, I can't, say when he would specifically make that decision. But it is an ongoing discussion every day, and we're in talks with the mayor, of course. I mean, that's not a decision that we would make in isolation.
But you guys could make that decision without the city of Mobile?
We could.
Because you guys have that.
Not for Clark County, as he
No,
said.
but for Mobile. I'm saying
Sure.
for Mobile.
We could.
But at this point, you guys have not. Or at
We
least
have not, you're right.
Dr. Eichel has not told you
Dr.
that
Eichel does not. You're right. But it's something that, it is a decision that is up for discussion all the time. I mean, it's a balance of what is the right thing to do.
Are people's concerns valid who are commenting on, who watch the news every day and commenting on social media that they believe that one should be put into place? Are their concerns valid or are they not? I mean, can you speak to them who are watching right now? To calm them down?
I can't speak to their concerns because for everyone who thinks that everything should be completely shut down, there is somebody who thinks that everything should be completely opened up. So, it is a constant process of evaluating the risks of every decision that we make. And I want to try to reassure you that the decisions are being evaluated on, a daily, if not hour by hour basis of what's the right thing to do to keep people safe. And the more that people stay home and limit what they do to essential functions, the better it will be. And
not only can the health department do a shelter in place, as we saw in Jefferson County, can
I don't know that information.
The White House also, they commented that we would need around 3,500 ventilators, possibly,
For Alabama?
for the entire state, and that we have an extreme shortage compared to other states. Do you have anything to say on that?
So the question or the comment really was that in this, is that the, what is it, IMHE or I? So he's referring to a website that projects the peak day and illness of, is it still April 20th that is projecting?
This October, they said by October.
Oh, okay. Not just the spike. Okay. Basically, deaths and for it has it for the state of Alabama and every state in the United States in general, and predicts shortages of PPE, of beds, of ventilators, and could I comment on the shortage of ventilators? That's something that if you look at any state, pretty much you'll see that they expect a shortage of beds, of ventilators, of equipment. We are in a similar situation as everyone across the country. Everyone is scrambling to try to find everything they can. So that is why the push to flatten the curve is so critical, because if we can spread this out over time, then we can get people through the phase of, this group of people needing the ventilator, getting better, hopefully getting off. And then we don't think this is going to go away. That's not what flattening the curve is about. But if we can just slow down the spread instead of having that spike, to spread it out over time, then the idea is to make that equipment available for people so that you don't have that extreme usage, but that it's more of a constant or consistent usage over time. So there's not that extreme shortage at any one point. But everyone is in a fairly similar boat, and you see companies changing their production. Tesla making ventilators, Caligas locally making face shields. Everyone is doing what they can to help out. So. Okay, great. Thank you.
Mayor Stimpson, kind of talking about the executive order again. Where did the formula of taking the square footage and dividing it by 75 come from? And then do those stores have to submit that number that they come up with to the city to see if that's accepted?
So the question is, where did the quick formula come from, determining what the capacity of the big box stores are, and how do they coordinate what they've come up with the city? So Matt Anderson, who works on staff, has worked with the fire department and with Bill Mobile that gives the permits out, and they calculated square footages. They came up with a formula in-house. We talked to the fire department about it. They agreed that for the purposes of what we're trying to do, that we're close at this, because really the real measure is that if you walk in the store and visually see, that there's too crowded, and you'll know it just like anybody else would, then we need maybe look at the 40%, and so do we drop it to 30? But I'll say this, that just to show you how seriously some of the store owners are taking this, is that Home Depot said we're not going to allow more than, I think it was 120 people in the store, and that can't be 20% capacity, what it really could be. So everybody is trying to maybe do a little more than what's required of them so that it doesn't come into question. That's my assessment at this time.
On that, the formula you came up with, the square footage divided by 75, is that for the overall capacity, or is that, and then you take the 40% from that and come up with what their capacity should be now?
No, I think that actually gets you to the 40%, doesn't it? It gets you to the 40%. Yeah. Good question. The question was that the little simple formula, you take the square footage divided by 75, then do you take 40% of that? No, if you divide by 75, that is the capacity number that we'll be looking at.
The emergency capacity.
Yes, emergency capacity.
Okay. And then I wanted to ask you, If you were to make the decision to call for a shelter-in-place or call it a shelter-in-place order, you were the health department, whoever wanted to do it, in your mind, what changes from what we're doing now to when you call a shelter-in-place? I mean, because people all over the country are still going to the grocery store.
Yeah, so that you will still go to the grocery store. You still have to be able to do the things that you have to function. You still have to have the utilities out there. You still have to have banks. That's why I'm saying that the shelter in place, some people in their mind, they just think everything shuts down, but there's exceptions to all of it. But the way you asked the question prompts me to say this, that I talked to Dr. Cepeda an hour ago. And I told her that as we were considering steps that the city could take going forward, that we were going to do it in conjunction with Dr. Isho. You know, we would be explaining to him any thoughts that we had. We would take his input to see if there was something that we needed to tweak or do differently. The point is that we are communicating. That's why Dr. Cepeda is here every single day, so that we can make sure that the Mobile County Health Department and the City of Mobile are collaborating on the steps that we're taking going forward. And so that's not to say that on every single thing that each of us may do, that the other 100% endorses it, but we know what each other are doing, and we're trying to reach the best decisions by collaborating.
If you did a let's say you did a shelter in place, in your mind, does that mean that people wouldn't be able to get takeout or anything like that anymore?
It could.
In your mind, what does that mean?
It could mean that, but I'm not going to say it does mean that. And the question is, you know, Dale was trying to pin me down on some of the specifics of what it would be different. And Dale, I'm not going to let you do that. Yeah, when we're ready, we will tell you. But Dale, it's like one of the other mayors said, that if by doing a curfew, if that addresses 10% of the population that had not been previously addressed, that's 10% that, you know, now maybe you have cause to stay at home. If we come up with a shelter in place and we change some things so that it may hit another 5, 10, or 15% of the people, then you're trying to create social distancing, staying at home, and so it's an incremental movement is what it really is. Yep.
We've kind of asked every day about, one of the stations has kind of asked every day about the update for hazard pay. We're still getting questions in. Is that still a discussion? Is there any update to it?
So, you know, the media's gotten a lot of questions and probably prompted by policemen and firemen to ask this question about hazardous pay. We are working on that. I think my comment yesterday was that within the next 48 hours, we will really understand what that means. You know, keep in mind that when the county makes a recommendation to do hazardous pay, and they're talking about the sheriff's department, that is a very finite, very well-defined group of people within their organization. If we start talking about hazardous duty pay, you're talking about 900 first responders. Then it throws out other questions about, you know, what about sanitation? So all those things have to be looked at and answered before you say that we're going to do whatever it is that we may do. And you can't do that on the back of a matchbook. I mean, it takes a lot of calculation and looking at positions before you're able to make an informed decision on that.
I mean, it sounds like it would also take a lot of money to pay that. Would that come out of a rainy day fund, or is there any idea at this point where that money would
Well, the question is so that if you did something similar to a hazardous duty pay, would it come out of the rainy day fund? Well, it could come out of the rainy day fund, but let's say in the past when there's been hazardous duty pay given, it's typically, again, going back to a finite period of time having to do with a hurricane that, you know, over a period of a month, 6 weeks, and I really don't know what the duration always is, but it ends. But if you would, let's just say hypothetically, if you would have to go pay everybody in the city hazardous duty pay right now, you're going to run out of money faster, and so then what do? So that's the point I'm making is that yes, we can do this, but what's the second order of the decision? What's the third order? How does it impact everything? Because we've got to be able to, we've got to come out on the other side of this strong, not handicapped. And so I want to be very thoughtful about doing it and make sure that it's the right thing to do.
Are the 30 first responders that have tested positive for the antibodies, are they part of the 60 total Mobile County cases?
I don't know that. No, they're not. The question was, are the 30 first responders who have tested positive, are they part of the 61 in the city, and they're not counted in that number? I think there was a question for Dr. Admire.
Yeah,
Yep.
this is coming from one of our digital content producers. If a minor child needs hospitalization because of this, will a parent be able to accompany them inside? I know in New York, specifically, they weren't allowing that because of how contagious something like this was, and obviously PPE would have to be used on that parent as well in that area to try to prevent the spread. I know it's going to be different for every hospital system. In your guys' case, are you guys allowing parents to accompany their children under 18?
That's a good question. Every hospital has their own policy on visitation during this pandemic.
Can you repeat the question?
The question was, can a parent accompany their child that is admitted to a hospital? And we have a policy, no visitors. But we look at each individual case. If there is a child involved, that is an extraordinary circumstance. I'm sure Women's and Children's at USA has their policy. We have our neonatologists and such at our hospital. But we have a no visitor policy at this point, but each case is looked at individually. And in the case of a mother and a child, or a parent and a child, yes, we will make exceptions. But we will follow all PPE, personal protective equipment, and we make sure that no one coming into our hospitals is going to cross-infect any of our healthcare workers or patients.
So, any more questions? If not, I see there looks like there may be one. Okay, you're going to give us a pass. In last night's newsletter, for those that read it, we had a lot of feedback about this. Day before yesterday, I received a text from a friend, and it was a video of a little girl, and her name was Rachel Grace Loper. And it was sent to me, and it's the daughter of a friend, and this little text said, Rachel Grace told her mother she wanted to be videoed, and there was no coaching, no lead in. The little girl just sits there and she starts talking. And it's Rachel Grace Loper. And I've had about 4 or 5 people respond, and they say, out of the mouths of babes. It's worth listening to. It's one of those inspirational things to give you a lot of hope. And so I will end with that, other than asking that you do this. Please continue to pray, because God's still in the business of answering our prayers. Thank you very much.
You have the lob.